During this ASH, we are presenting a study entitled Longitudinal Immunogenomic Profiling of Tumor and Immune Cells for Minimally Invasive Monitoring of Smoldering Multiple Myeloma, the iMMunocell study. I think that nowadays everyone is already very much familiar with the new risk stratification model for smoldering myeloma by the International Myeloma Working Group that identifies high-risk patients based on the presence of a serum M spike over 2 grams per deciliter, a free light chain ratio greater than 20, and more than 20 bone marrow plasma cells by morphology. If we look carefully to the model, it is based on 2 serological assessments and 1 bone marrow test. And therefore, it would be ideal if we could replace the bone marrow test by a minimally invasive biomarker. Because if we could replace a bone marrow test by a minimally invasive biomarker, this would imply that we could reevaluate the model, for example, every 6 months. And if we are able to recalibrate the model every 6 months, perhaps its potential to identify high-risk smoldering myeloma would be improved. Therefore, the aims of the iMMunocell study group are to determine the level of concordance between tumor and the immune landscape in bone marrow versus peripheral blood of patients with smoldering myeloma, to evaluate immune profiles together with circulating tumor cell numbers and genetic alterations every 6 months in peripheral blood as minimally invasive methods for the identification of smoldering patients at risk of developing active myeloma. This study aims to enroll 300 smoldering myeloma patients that are monitored in peripheral blood every 6 months. And here at ASH, we are presenting an interim analysis of the first 150 patients enrolled. The conclusions of this interim analysis, which I believe is the first study performing CTC and immune monitoring every 6 months in peripheral blood samples from patients with smoldering myeloma, suggests that there is a significant correlation between CTC counts and stable versus progressive disease, and also suggests that CTC kinetics could be complementary to the 2020 criteria for real-time, let's say every 6 months, identification of individual smoldering myeloma patients at risk of developing active myeloma. Importantly, beyond CTC numbers, which perhaps could be already expected due to pre-existing data, this study is also uncovering key immune cell types that are associated with the malignant transformation of smoldering into active myeloma.